All right, here we are with another walkthrough on how to use the Get It Covered tool. So on the previous video, we reviewed how to ask for a level of care. We used a skilled nursing facility as an example. Now I'd like to show you how to leverage this if you need a device, or like because I have experience in DME, CPAP, or commode, something of that sort. So I'm going to use CPAP on this example because it is oftentimes so difficult to get the documentation that various insurances need. So I'm going to go ahead and type in CPAP machine. Again, we're going to have it build the guide, and then once it's done, it will populate below. And again, this is going to be in that same format. It's pulling directly from CMS coverage, and it's going to walk through the documentation you need, the criteria that you need, because I want you to think about when your request goes to the insurance company, the person reviewing it is often a nurse case manager, and they need to make sure that you check all the boxes for their criteria. And then if you're kind of there and they're not sure, sometimes that can go to a physician, and then that physician has to review it, and then they're the final decision maker. But this is a space where, again, getting the documentation right the first time is going to give you the strongest piece to get it done, so you can either get the support you need or get out of the hospital. So here we go. Our report is generated. We have the option to save as a PDF. It's going to list our CPT codes here. And then again, same exact format, Medicare qualification, because again, that's our gold standard that goes through what we need. Patient eligibility criteria listed out in each bullet point. Physician required documentation. This is the most important part for your insurance submission. Face-to-face encounter, your doctor has seen you, how often it has to happen, because with some items that your doctor orders for you, you do have to go in and do a repeat appointment. Standard written order, eligibility. Again, we have linked to the Medicare.gov website, so you can go through and read that yourself. Now, Medicare's off the table. We're going to look at commercial insurance. These are steps to optimize the approval because we want to make sure that we get it that first time that we go around. We don't want to have to go back and forth. No one loves to dance with insurance companies. So, goes through again, common reporting documents. We need to have your sleep study, physician note, a prior authorization form for the insurance, and then letter of medical necessity. Sometimes, just depends on your insurance. And then also common denial reasons. So why would they deny it? Sometimes, as odd as this sounds, you're not sick enough or you don't have bad enough sleep apnea, and that could be something, but that's a conversation to have with your provider. Or you will also receive a letter in the mail stating what didn't work. And then again, because as patients, we also own a portion of this with accountability. What's our action plan? What do we need to make sure that helps our providers do their full documentation so when they do submit for that insurance authorization, it goes through the first time. So these are just, it's the same structure, but you're able to put through any of the potential discharge needs you have, whether that's a level of care, going to a skilled nursing facility, or it's an actual device that you need. All of this pulls from the CMS, and it's a good foundation, again, to help you structure your questions for your care team.